1. Article 156, employers are expected to train a sufficient number of employees in first aid treatment. A. True. B. False, first aid training is optional. The answer is A. True. 2. Article 157, in case the workplace is not considered hazardous. What professional can an employer hire in place of a registered nurse? A. A medical doctor. B. A physical therapist. C. A graduate first aider. D. A medical professional is not needed. The answer is C. A graduate first aider. 3. Article 157. When the number of employees exceed 200 but not more than 300, the employer is required to provide which medical benefit in the workplace? A. A full-time registered nurse. B. A part-time physician. C. A part-time dentist. D. A clinic. E. All of the above. The answer is E. All of the above. 4. Article 157, when the number of employees exceed 300, are employers required to provide the service of a full-time physician? A. Yes. B. No, full-time physicians are never required, no matter the number of employees. The answer is A. Yes. 5. Article 157, in cases of hazardous workplaces, how long are full-time physicians required to stay in the establishment? A. At least 8 hours. B. No more than 8 hours. C. 12-hour shifts. The answer is A. At least 8 hours. 6. Article 159, the following are the tasks of an establishment's full-time physician, except A. Attend to medical emergencies. B. Provided basic medical services. C. Implement a comprehensive health program. D. Perform elective surgery. The answer is D. Perform elective surgery. 7. Article 165, what government agency is responsible for developing criteria for medical personnel to ensure that they are properly trained in the field of industrial medicine? A. Department of Health. B. Department of Labor and Employment. C. Department of Interior and Local Government. The answer is B. Dole. 8. Article 167, which of the following is not a dependent? A. A legally adopted child. B. A married child. C. A mentally incapacitated child who is over 21. D. A legitimate spouse. E. Financially dependent parents. The answer is B. A married child. 9. Article 167, the following are primary beneficiaries, except A. Dependent spouse. B. Dependent children. C. Dependent parents. The answer is C. Dependent parents. 10. Article 167, this term refers to any harmful change in the human organism from any accident arising out of and in the course of the employment. A. Bodily harm. B. Injury. C. Emergency. D. Accident. The answer is B. Injury. 11. Article 167, a quarter is a period of 3 consecutive months, ending on the last days of March, June, September and December. What is a semester? A. 5 consecutive months. B. 2 consecutive quarters. C. 12 months. The answer is B. 2 consecutive quarters. 12. Article 167, it is the sum of 20% and the quotient obtained by dividing 300 by the sum of 340 and the average monthly salary credit. A. Salary credit. B. Semester payout. C. Replacement ratio. The answer is C. Replacement ratio. 13. Article 167, it is the amount equivalent to 115% of the sum of the average monthly salary credit multiplied by the replacement ratio, and 1.5% of the average monthly salary credit, for each credited year of service in excess of 10 years. A. Credited years of service. B. Monthly income benefit. C. Average daily salary credit. The answer is B. Monthly income benefit. 14. Article 168, until what age is the coverage? In the state insurance fund compulsory? A. 65. B. 60. C. 70. D. 55. The answer is B. 60. 15. Article 172. The state insurance fund shall be liable for compensation to the employee or his dependents in the case of the employee's death, except in what conditions? A. Suicide. B. Death due to intoxication. C. Notorious negligence. D. All of the above. The answer is D. All three disqualify the employee. 16. Article 183. When a covered employee dies, becomes disabled, or separated from employment, what happens to his employer's obligation to pay the monthly contribution arising from that employment? A. The employer will continue paying the employee's contribution for the benefit of his dependents. B. The employer's obligation shall cease at the end of the month of contingency. The answer is B. The employer's obligation shall cease at the end of the month of contingency. 17. Article 189. How much is the income benefit paid by the system in cases of temporary total disability? A. 100% of his daily wage. B. 200% of his daily wage. C. 90% of his average daily salary credit. D. 50% of his average daily salary credit. The answer is C. 90% of his average daily salary credit. 18. Article 192. In cases of permanent total disability, for how long does the system pay the employee a monthly income benefit? A. 5 years. B. 10 years. C. The same number of his employment years. D. Until his death. The answer is D. Until his death. 19. Article 192. What condition suspends the monthly income benefit for permanent total disability? A. When the employee recovers. B. When the employee becomes employed. C. Fails to present himself for examination at least once a year. D. All of the above. The answer is D. All of the above. 20. Article 192. The following disabilities are considered total and permanent, except A. Temporary disability that lasts more than 120 days. B. Complete loss of sight for both eyes. C. Loss of 2 limbs at or above the ankle or wrist. D. Permanent. Complete paralysis of 2 limbs. E. Brain injury resulting in incurable imbecility or insanity. F. All are considered permanent total disabilities. The answer is F. All are permanent total disabilities. 21. Article 193. How many months is an employee paid a permanent partial disability benefit for losing a thumb? A. 10 years. B. 5 years. C. 10 months. D. 5 months. The answer is C. 10 months. 22. Article 193. How many months is an employee paid permanent partial disability benefit for losing an arm? A. 10 years. B. 5 years. C. 50 months. D. 10 months. The answer is C. 50 months. 23. Article 193. How many months is an employee paid a permanent partial disability benefit for losing sight in one eye? A. 10 years. B. 5 years. C. 50 months. D. 25 months. The answer is D. 25 months. 24. Article 202. In case of the death of an employee, what happens to the death benefit if the money is payable to a minor or incompetent? A. It is forfeited. B. Only 50% is given to the beneficiary. C. The system decides who is best qualified to take care and dispose of the minor's or incompetent's property for his benefit. The answer is C. The system decides who will oversee the payment. 25. Article 206. Employees or their dependents are required to give notice of sickness, injury, or death to the employer within what period? A. 5 days within occurrence. B. Within the year of sickness, injury, or death. C. No specific time frame. The answer is A. 5 days within occurrence. 26. Article 207. What is the penalty For any person who commits fraud, falsification, or collusion to claim a benefit? A. Return of the claimed benefit plus 25%. B. 100,000 pesos. C. Imprisonment of 6 months to 1 year. The answer is C. Imprisonment of 6 months to 1 year.